patients that will benefit entirely to radiation or chemo, and the cancer will go away and they'll be in remission, and then it comes back. Why did it come back? If the chemo did its job 95% of the way. It killed 95% of those cancer cells and left a few stragglers. Unfortunately, those stragglers are still cancer, and they're just going to start growing again. So those leftover cells, 1 becomes 2, 2 becomes 4, and they just start over. Usually, these are cells that are now resistant to that type of chemo because they've adapted and changed, or they were always resistant, and that's why they survived in the first place. Your immune system doesn't work that way. It doesn't eliminate half of the threat and leave the other half behind. It doesn't work that way with the flu. It doesn't work that way for strep. It shouldn't work that way for cancer. It needs to get rid of all of it. It needs to then kind of reduce into what are very powerful immunological memory cells. And then those cells continually circulate and survey your body to look for any potential reinfections, or in the case of cancer, relapse. If it sees cells with those same markings start to pop up again, which they may, because you may still have the mutation that drove all that. Depending on what caused it, you may still be prone to trying to develop that cancer. But if your immune system is on, it wipes it out. And it wipes it out quicker, and you may or may not know.